So I'd like to present a case of popliteal artery aneurysm.
Okay.
And let's get into it. So this is a 52-year-old male who was referred from the GP for a lower limb arterial ultrasound. Symptoms of cramp on walking, ease by rest, more so on the left side. His peripheral pulses were difficult to palpate, and more unusually in this case, he had bilateral swollen legs. So started ultrasound was fairly unremarkable. Femoral arteries were flowing quite nicely, but as we track down the leg, we can see the image on the left. This is the popliteal artery here, left popliteal artery, and the popliteal vein. You can see that there's a left popliteal artery aneurysm, and the vein is compressed. Looking further down, you can see that the flow in the posterior tibial arteries is quite reduced. And in the lower right image, a transverse image of that popliteal artery aneurysm, you can see that the popliteal vein is quite compressed. On the right side, again, there's a popliteal artery aneurysm in the top left image. You can see that there's probably around about 60% mural thrombus there, and there's actually flow through the lumen. The image on the lower left, you can see that the popliteal vein is compressed, and you can see that it's similar, slightly distal as well. And usually in this case, because when we see popliteal artery aneurysms, we want to check that there aren't aneurysms elsewhere. The aorta is normal caliber, fairly normal caliber. And you can see on that right side that the posterior tibial and anterior tibial arteries, the waveforms, spectral waveforms, there's good triphasic flow there, which is good. In the lower right image, you can see though the amount of subcutaneous edema that's in these lower limbs. And speaking to the vascular surgeons, they think this is down to the venous compression. So you could quite easily see how easily a patient could present in an A&E department, especially with the right leg, which is fairly well perfused and warm, and they've got this amount of edema in the lower limbs caused by the venous compression. So the patient was referred to the vascular team. They underwent a CT angio and a vein map in order to surgically repair the right popliteal aneurysm with a FEM2 TPT exclusion bypass graft. You can see that the results from the CT angio map exactly what was found on the ultrasound. So there was good flow in that right-hand side. This is the CT angio. So you can see in the orange arrows that there's a blow up of the image on the left, on the top right. You can see that the veins are compressed. More so probably in the images on the bottom right, you can see as the veins run past the popliteal aneurysms, you can see that they're compressed. This is just to prove that there's good flow through the right popliteal aneurysm, and there's good flow in the tibial perineal trunk as a potential landing site for that exclusion bypass. So this gentleman came back in June this year after his exclusion bypass. We can see that the proximal anastomosis is flowing quite nicely, triphasic waveforms, but we can see that there's post-operative stroma. There's quite a large amount, and he was quite uncomfortable with this. Main graft is widely patent, as is the distal anastomosis. And in the lower right image, you can see that the amount of subcutaneous edema is actually increased. So he's still getting this leg swelling, which we can show in the image on the top right. You can still see that the popliteal vein is being compressed. So when we're looking at these vessels, an aneurysm is defined as a focal dilatation, which is 1.5 times the normal vessel diameter. So for case for a popliteal aneurysm, it ranges between 0.7 and 1.1 centimeters. The incidence of popliteal artery aneurysms was quite a broad range here, 0.1 to 2.8% in the general population. The most common form of peripheral aneurysm, more common in men, and the incidence increases with age, as you'd expect. But this is the key part for our department as a vascular service. So popliteal artery aneurysms show a strong association with trypase, so about 40 to 50%. And quite a number of these cases, 20% of the cases, are bilateral in one study. So this is why if we see a patient with an abdominal aortic aneurysm, we scan the iliacs, popliteals, and femoral arteries as well, as standard for first presentation of the patient that's coming to see us. So yeah, we'll have any questions. If you can pop anything in the chat, that would be great. I think I'm going to move on to my next talk in a minute once we have a look at those.